Thank you for the chance to share some of our research on the ongoing COVID-19 pandemic and economic slowdown. This is part of our work in the Ateneo Policy Center, and I am pleased and honored to join you today to share a few insights, hopefully, and some evidence and data on the macro and micro benefits from stronger universal healthcare systems, as well as UHC that is underpinned within a broader framework of strong and inclusive social protection. So, as is my practice, I always begin with the main messages of my presentation, and I have a few. First, lockdown is useful if it buys us time to strengthen the health systems and test, trace, treat systems. However, if we fail to strengthen these systems, then we squander the time that lockdown buys us. And I just want to emphasize this point that after over a year of the pandemic, it has become clear that lockdown is not the main measure for containment. In fact, it's a very, very expensive, very, very costly measure to contain COVID-19. What lockdown does, however, for countries that need to catch up, that need to strengthen their systems, is it buys them time. And so it is important that you use that time to actually strengthen those systems so that you can shift to a more nuanced, more effective containment strategy that is not necessarily as expensive, as costly as a full mobility restriction, a full lockdown. Second, if we are unable to graduate to more efficient containment strategies, we are stuck with on again, off again lockdown, which is severely damaging to the economy. So this is very clear. Unfortunately, this seems to be the situation of the Philippines right now, where we are unable to shift to a containment strategy that contains COVID-19 while at the same time offers us the flexibility to keep much of our economy moving, right, and working. So unfortunately, there is growing concern that the present containment strategy is not strong enough. Test, trace, treat is not yet up to snuff, and the healthcare system is actually facing a lot of stress. Third, weak results on test, trace, treat, and delayed rollout of vaccination, now compounded also by vaccine hesitancy to the extent that this may still be a challenge for part of the population. These are all likely to lead to delayed economic recovery. So this is quite an unfortunate situation and clarifies the challenges that the Philippines needs to overcome. And finally, based on the emerging evidence and probably closest to the theme for today, we find evidence that strong universal healthcare countries with highly adaptable healthcare systems, along with well-coordinated economic and social protection strategies, tend to fare better. They don't necessarily need to rely on draconian lockdown and containment strategies. They can keep their economies operating while at the same time keeping COVID-19 at bay. They are able to graduate out of lockdown faster. They have the confidence to actually bring back economic actors to run the economy again. And they maintain effective containment strategies even with more relaxed mobility restrictions and more open economies. And I believe that this is now the main emerging lesson 2021, where we are coming to grips with the deeper understanding on what the new normal really is from this pandemic. So before I go on to the details, I just want to give you a analytical framework that we have used, which many experts have used to try and understand some of the terms and some of the strategies that we have deployed to contain COVID-19. And this also links to the economy. So this is the often cited COVID-19 curve. It is the daily number of COVID-19 cases on the y-axis and time on the x-axis, and 1A being the peak of the daily number of COVID-19 cases. So this is the potential peak that many countries would like to avoid, particularly if the peak is much higher than the maximum capacity of the healthcare system. So if you have a healthcare system that will be overrun or overwhelmed by a peak of 1A, then what you want to do is keep the peak below the maximum capacity of the healthcare system by containing the spread of COVID-19, keeping it at 1B, and if you are successful, pushing it all the way down to 1C, near zero COVID-19 cases. So this is the basic challenge faced by nations in 2020 and 2021. And we are coming to a deeper understanding of what is needed moving forward into the new normal. And here it is probably important to describe some of the phases of pandemic response, just to be clear about the narrative. One is the disease outbreak, and of course, this was early in 2020. The goal of many countries was to actually call the crisis early, make sure that you apply the mobility restrictions to prevent it from getting out of hand, and immediately begin to curb the COVID-19 incidence. Crisis relief occurs when you already have a high peak and you're trying to temper it and push it down, and you may or may not have to apply really deep mobility restrictions. And when we say deep mobility restrictions in a country like the Philippines, what that means is you really need to provide social protection, particularly for the vast majority of poor Filipinos and low-income Filipinos that rely on their daily wages. And if they don't get those daily wages, then they will need to get additional resources in order to maintain their nutrition, maintain their food access. The third part, of course, is the sought after crisis recovery period when COVID-19 cases have actually gone down sufficiently, maybe even near zero, as some countries have demonstrated. New Zealand is one example. And finally, there is still a debate and now a growing understanding of what the new normal might look like. There's now a discussion that vaccination, mass vaccination, is not necessarily a ticket out of the pandemic, largely because herd immunity may not necessarily be achievable by many countries, meaning that the threat of resurgence of COVID-19, including its new variants, may actually be here with us for some time. So in that kind of a situation, where vaccination is not necessarily going to end the risk, and herd immunity is not necessarily going to be the main goal, at least according to this school of thought, then it actually emphasizes even more the importance of the systems, particularly the universal healthcare system, the test, trace, treat system, and that containment strategy that you need to have in place in order to prevent a COVID-19 breakout, or in fact any future disease breakout, just like COVID-19. So the main link is what I want to emphasize next, which is as you are going through those phases of pandemic response, you are also managing the economy and making sure that the cost of pandemic response is not necessarily too deep. And of course, the goal from moving from 1A to 1B, when you are tempering the number of COVID-19 cases, and if you need to rely on lockdown, you are most likely going to trigger an economic contraction, which is what the Philippines also experienced. But the goal actually of mobility restrictions is to keep it as short as possible, as effective as possible, so that you're catching up with your buildup of the healthcare system, buildup of the test, trace, treat system, so that you don't need to keep the costly measure in place for long. And you can now graduate to a recovery period and perhaps a containment strategy with those systems in place that do not necessarily need a draconian lockdown as a potential containment measure. So I agree actually with the assessment recently by the regional World Bank economist that mentioned the Philippines as one of those countries that failed to graduate to a more efficient containment strategy for COVID-19. We have had to revert to a very draconian flavor of lockdown, on again and off again in the past year and a half. So this is actually quite troubling because it reflects that we have not been able to build up the systems that we may now need as a permanent fixture of a universal healthcare system in order to prevent the recurring risk of a COVID-19 or any disease breakout. So what are the challenges for the Philippines? I think many of these are well known as they relate to the universal healthcare system. Well, we managed to pass a very important reform, and kudos to the reformists in the Duterte administration that passed the universal healthcare law. This is an important step among the many steps that we have been taking to strengthen our universal healthcare system. But it is by no means sufficient because we do need to keep strengthening our universal healthcare system. And one of the big challenges of our healthcare system is that the out-of-pocket cost is still very, very large. And so, with this kind of a situation, the vast majority of our population is still likely to defer healthcare seeking. And in that kind of a situation, the Philippines remains vulnerable to the situation of a disease breakout if a majority of your population is not necessarily going to healthcare seek, even if they become sick. And that is going to turn out in terms of bigger risks to communities because of people who are not necessarily going to take the necessary healthcare measures to prevent the spread of COVID-19. So the weak inclusion in the healthcare system is something to begin with that we need to overcome. It was and is the situation in the Philippines. And so this, of course, does not help us in responding to the pandemic. This is just an anecdote of a young doctor. I find it useful. My patient, a farmer, sold his carabao to be able to afford an IJ catheter insertion for dialysis. And the surgeon charges 15,000 even on a government hospital. So even with government services, there are still big costs. Ordinary people try their hardest to live every day. And he says, I hope people in power can exert the same effort for the country. This is another element of the challenge. It is not just the universal healthcare system that is important, it is also offered within the context of hopefully a strong social protection system. And in the country, that includes actually providing food support and income support to the vast majority of low income and poor Filipinos in case there is a need for very, very serious lockdown, targeted lockdown in some cases for communities where an outbreak occurs. And here I just have a picture from somewhere in Cebu. This is posted by some of the residents. If you cannot feed us, free us. The spread of COVID-19 is not our fault. Stop the discrimination. And of course, this just reflects um, a growing challenges of many Filipinos who face COVID-19, who are asked to actually stay at home and respect the lockdown and mobility restrictions, and yet are not necessarily given enough support in order to participate effectively in this lockdown measure. So this of course again emphasizes that it's not just the universal healthcare system, but the many other systems uh, that need to be in place in order to produce the best collective action result, which is containing the disease and minimizing the economic cost from the pandemic. This is another situation I just wanted to show you. This was in 9 May 2021, just a few weeks ago. And this was during a period when we had already upwards of 6,000 cases, thereabouts, if I recall correctly. I could be off by a few hundreds, but this is the situation where a large number of our countrymen and women are already exhausted from lockdown, basically looking for relief, but unfortunately in ways that may not necessarily be guided by evidence anymore, and may even increase the risks for certain communities. So um, and this was actually an image shared at the recent meeting of scientists of the National Academy of Science and Technology. And we basically asked ourselves very candidly whether Filipinos still listen to science and evidence. And of course, one of the answers is also a question: do Filipino leaders convey evidence-based policy? So this is something that obviously is within the context of a strong universal healthcare system as well. Without a commitment to strong evidence-based policies, not just in healthcare, but in the other ancillary policies and systems that form the context of a strong healthcare system, then you will have a difficult time imagining universal healthcare system making a difference. So here, I just want to mention another message, which is it has often been framed as a dichotomy between the health of the nation or the health of the economy, essentially a trade-off between the two. And I believe this is a false dichotomy. And this is reflected in the strategies of other countries that have managed this pandemic much, much more effectively than the Philippines. In fact, this is the leader of South Korea who mentions we have to keep in mind that if we fail to contain COVID-19, we will fail to grow our economy as well. And this is correct. If you fail to contain the spread of COVID-19, if your containment measures are consistently shown to be weak and ineffective, then investors, tourists, all the economic stakeholders will see this and will expect an on again, off again lockdown, that you are forced back into the most draconian of measures to contain the spread of the disease. And this, of course, is going to be a bad signal to all the economic actors because it will essentially weaken the confidence in the recovery and force many actors to actually play a wait and see game. So this is part of the challenge right now, not just in any effort to curb the next surge, but in proving and showing that the capability is now strong to prevent any such surge from derailing the economy. And unfortunately, this is still up for debate right now. And of course, there are many who are questioning whether that system is really in place. So I'm going to end the presentation with just a few examples of universal healthcare systems that seem to be strong, the context in which they are existing and applied, and the countries that have managed to fare better, both health-wise and economy-wise, from the past year and a half tackling this pandemic. And they all seem to demonstrate, as a building block, a strong universal healthcare system that is underpinned by many other things. And I'm just going to emphasize a few of those things. First, Taiwan is often cited as one of the gold standard examples of COVID-19 response. And one of the things Taiwan is well known for internationally is that it has a very, very strong national health insurance system with almost 100% coverage for all Taiwanese citizens. So they give the citizens confidence that if they get sick, they should health seek. They should actually look after their own health, which at the same time, de facto also protects the health of their families and their communities by preventing the spread of the disease by health through their health seeking and through their more prudent behavior. And so Taiwan is one of those examples that as a starting point already has a strong universal healthcare system and a very, very inclusive health insurance system, which then gives their citizens a great deal of confidence to do the right thing and actually health seek and prevent the spread of disease. Thailand is another example. It's an interesting example for the Philippines because it's probably closer to our level of development and also our background. And Thailand has a very strong record of health campaigns, basically working with civil society groups, academia, and other groups to work with communities, work with citizens to understand the importance of health-seeking behavior, of behaviors that promote better health in the country. It also has a strong track record of public-private partnerships. And Thailand, uh, according to this report, has almost 40,000 health facilities in the country. And about 35% of those are state-funded. And the vast majority of those health facilities are actually private ventures, privately funded. And that is actually close to the situation of the Philippines right now, depending on the type of hospital, level 1, level 2, level 3. In the Philippines, the figures are probably going to be close to Thailand in terms of the public-private balance. And the lion's share of private healthcare facilities, healthcare facilities in the Philippines are accounted for by the private sector. So there needs to be a history of strong public-private partnerships because it helps when you have a pandemic and you need close cooperation, and that long history somehow helps you set up better, much more strongly against the pandemic. Then there's also the example of Vietnam. In Vietnam, the important ingredients of transparency and trust, citizens voluntarily shared personal health information to their government through a singular app called nCoV. And I note here that unfortunately in the Philippines, our test, trace, treat system is still not basically set up in a single system. So we have fragmented test, trace, treat systems still, even in Metro Manila, as I understand it. And this, of course, prevents the more effective use of the data and information for a more nuanced targeting strategy for mobility restrictions and healthcare interventions. So without that information, there is no nuance. And without nuance, you are then pushed back to the draconian lockdown measures that is sort of a catch-all, um, all size, one size fits all type of a situation, because of the lack of that data and because of the lack of that nuance. So Vietnam is able to avoid that. It is able to inform its healthcare policies more effectively, and therefore it was much more successful, in part because of this, in protecting the health of its citizens while at the same time keeping its economy running. And finally, I want to mention, and I would be remiss not mentioning another country that is treated as a gold standard in terms of pandemic response. It still faces risks. It still faces resurgent risks. But this is a country that has learned from previous pandemics, such as MERS and even SARS, and has put together some of the ingredients within its universal healthcare system of a more effective pandemic response, such as the network of labs that South Korea now has. So it was already in place, and the coordination was also um, well established going into the pandemic. It also established a strong surge capability for its healthcare system by being able to set up a triage system that is agile and that allows them to absorb a lot of potential patients. And this allows the healthcare system a lot more agility and a lot more absorptive capacity, so that that red line that I showed you earlier is able to adjust to the situation. So that's an important capability that South Korea seems to have established. And of course, just like Vietnam and other countries, the South Koreans actually put a premium on information, so that it has a high degree of evidence-based policy and strategies that allows it much more nuanced strategies and policies in responding to the pandemic. And those nuances that are not necessarily present in the Philippines, those are actually what allow these other countries a much more balanced approach to containment as well as protecting the healthcare of their citizens. I will keep it there, and in order to keep to my time limit, and I look forward to our discussion where I could elaborate a little bit more on some of the other finer points of the presentation. Thank you so much.